I said means the total, the prenatal care, right? Prenatal time or prenatal care. Then when mother come to you for the preparation, right? And then we has to take the history, mother past medical history. If mother is multipara, then previous pregnancy history, any medical condition. So everything we has to write down, and also immunization history. We has to go for physical assessment, right? So here I said, when mother is prepared themselves for 280 days pregnancy, and then this total duration we divided 3 phases. First trimester means first 3 months. Second trimester means in between 3 months, and third trimester, last 3 months. So keep in mind the how many times mother has to go for doctor visit or primary care visit, right? Or healthcare provider visit. So I said from the first week to or up to 28 weeks, mother monthly go, at least once a month, from beginning to 28 weeks monthly. Then 28 to 36 weeks, 2 weekly, right? And last phase means 36 to 42 weeks weekly. So up to 28 weeks monthly, mother has to go for doctor visit. Then 28 to 36 weeks, 2 weekly means twice every week, 2 times mother has to go for checkup. And after 36 to 42 weeks, at least weekly, once a week, mother has to go for visit. So if you ask me, after 42 weeks, if mother labor does not start, what we do after 42 weeks, right? That times healthcare provider decide induce labor or C-section. So again, I'm talking about the total duration is 38 weeks plus minus 2. Some baby before, but even 36 weeks. So if any labor start before 37 weeks, we tell preterm baby. Same as if any baby born after 40 weeks, we said post-term baby. So also here is in this table showing what laboratory test you have to write to the patient, what laboratory diagnosis mother need to do. First trimester, them. Second trimester, GTT and AFT, alpha fetoprotein or glucose tolerant test. If alpha fetoprotein is less than normal or decrease the normal, this is called patient develop Down syndrome. If alpha fetoprotein is more than normal, neural tube defect, right? So last trimester, we have to scan for STD, sexual transmitted disease, or any kind of bacterial, especially beta staphylococcus infection, we should check. If it is positive, we should give them penicillin G, right? So next here, nutritional status. Nutritional status. So during this phase, when mother prepare for pregnancy or labor, we has to make sure, we has to know how much calorie a mother has to take. It is 2200 to 23rd or 2300 calorie per day. What about the fluid? Minimum 2000 ml. 2000 ml means 2 liter. 1 liter equal to 1000 ml. 2 liter. Also, mother has to increase the protein intake, increase the iron, right? If mother deficiency of iron, develop the iron deficiency, anemia. So increase the folic acid. So folic acid deficiency causes neural tube defect. So folic acid to prevent neural tube defect, right? So here, what are the risks or danger sign during the pregnancy? The most danger sign during the pregnancy, if mother start sudden abdominal pain, this is the one of the danger sign, right? So we are talking that danger sign. So during this 38 weeks or 40 weeks or 280 days, when mother is prepared to continue the pregnancy, right? So that times we has to be concerned, or if mother have any sign, what I'm talking about right now, if any sign like this, mother should contact with the healthcare provider. So what are the risks or danger sign during the pregnancy? One is said, if sudden abdominal pain, if mother has a sudden abdominal pain before the labor, right? This is the danger sign. So keep in mind, if the baby is not full term, means baby is not mature, this sign, I mean abdominal pain, indicate a woman need to go to the hospital immediately. So before the full term or before the mature labor, if the sudden abdominal pain, mother has to go to hospital immediately. Another most the risk sign is the if mother has a vaginal bleeding. So we know during the pregnancy, each mother should be amenorrhea. But if suddenly bleeding, it indicate danger sign. So if a pregnant woman is bleeding, and never, also keep in mind, when a patient comes to you, you are RN, you have to deal with the patient. If a mother during the pregnancy has a vaginal bleeding, we will not, or if woman is bleeding, never assess vaginally. One of the exam is called digital exam Okay, so we will not exam to check the baby or anything. And also another problem during the pregnancy is called abrupt flow of vaginal fluid. So I said if suddenly vaginal fluid secretion, it is danger. If suddenly vaginal bleeding, it is also danger sign. So during the pregnancy, there are two cause of um, bleeding. One is here, it is called the placenta previa or abruptio placenta, right? So go back here, the normal pregnancy, or in case of normal case, the placenta is supposed to be here, the posterior superior, right? Here, placenta, normal placenta. But in case the placenta is there, position is there, okay, but there are some blood clot inside the placenta, right? This extra blood clot inside. This is called placenta abruption or abruptio placenta. Position is okay, but blood is clot inside. This is the placenta abruptio. And here, the placental position close to the orifice opening, right? Cervix of the uterus. So in this case, the chance of rupture, this placenta and bleeding is occur. In this picture showing same thing, this is the placenta previa, right? And placenta abruptio. Placenta is position is okay, but blood clot formation. So if the rupture, bleeding start. Here, the position of the placenta in close to the orifice is called placenta previa, blood clot, and chance of bleeding. So in case of this, so placenta previa, the character of placenta previa, the bleeding sometimes very severe or mild, but this is a painless. The bleeding occur, but it's painless bleeding. And also the placenta, I mean uterus is soft and non-tender. In case of placenta previa, I said painless bleeding character, and also the blood is red and uterus is soft or non-tender. In compare and contrast, abruptio placenta, the blood is not red or bright, and it is painful. This is painless, this is painful, right? And also the uterus is hard and tender. If NCLEX board asks any question about placenta previa or abruptio placenta, we have to know 2 points. In case of placenta previa, the pain, it is painless, and uterus is soft and non-tender. Whereas the abruptio placenta, they are painful, right? Painful, and also uterus is hard or tender. So here I said both of the cases, okay, causes the sudden vaginal bleeding, and this is the danger sign, and mother has to contact to the healthcare provider immediately. Another danger sign is called the puffiness in the face or swelling hand and foot, right? So if the swelling in the foot or puffiness of the face, it is also danger sign of pregnancy. So the two terminology, one is called gravida, right? Gravida means the number of pregnancy. Total number of pregnancies include current pregnancy. This is called gravida, right? And parity. Parity means the number of pregnancy that is give the live birth. Parity, full or term, preterm abortion, living child. So must be baby survive, living. So a woman, as an example, a woman has a 4 children. 2 are single and a set of twin. So what are the her parity? So a woman has a 4 children. Out of 4, 2 are single pregnancies and 1 set of twin. So twin pregnancy count as 1 single. So 2 single plus 1 twin is 2. Parity should be 3. So parity means the number of pregnancy that is give live birth. So normal pregnancy discomfort in each trimester, right? So you see, when mother come to you for counseling, you tell them this is the sign, it is common, nothing abnormal. When you tell this is the sign, and mother should be aware about this, they will not be panic, right? So first of all, the first trimester, most common sign is the morning sickness. Morning sickness means nausea and vomiting. So if a mother has a morning sickness or morning sickness because of blood sugar level drop, so tell the patient eat enough carbohydrate. Again, I want to recap it, my friend. The first trimester, mother has a morning sickness including nausea and vomiting, right? So the morning sickness because of mother blood sugar level dropping or drop. So we has to educate. We should teach our patient to eat dry carbohydrate at the morning, right? And also mother has increased the frequency of urine, increase the frequency of urine here. Also the heaviness in the breast or tingling sensation, right? And also excessive splitting. These are the common sign in early trimester or early pregnancy. So what about the second trimester? Most common, they have developed the constipation. So we advise them to take the food contain enough carbohydrate and fluid, and also increase the movement. Heartburn because the uterus give a pressure towards the GIT or stomach or esophagus. Heartburn is common, and sometimes pigmentation. The common pigmentation is called the linea nigra. So linea nigra, this is the pigmentation, right? So the sharp line in between or along the umbilicus. This is the nigra, right? So here, so linea nigra become prominent, and also mother sometimes eat some food, random things is called pica food, right? And also the second trimester or even third trimester, mother complain of leg cramp. So leg cramp are normal. It is normal, I said. So always tell your patient, do some exercise on the leg. It's called plantar flexion or dorsiflexion. So plantar flexion or dorsiflexion help to prevent leg cramping. So when mother come to you and explain about the leg clamping, we have to check the Homan sign. If we see there are Homan sign is negative, right? That means mother do not have any chance to develop the deep vein thrombosis. I said if mother has complained the leg clamping, we should check for Homan sign. If Homan sign is negative, means there are no risks of deep vein thrombosis, right? Homan sign should be negative here, right? So here, and also the last trimester, mother can complain the back pain. So if mother complain the back pain, as a RN or LPN, we have to teach them to maintain the good posture. Maintain the good posture. Always, always have to avoid high heel. High heel should avoid. Also, we can tell them to do some pelvic rocking technique exercise. Pelvic rocking, right? So this type of exercise is help to back pain, and also we can tell to mother to do the Kegel exercise. Kegel exercise. The NCLEX board which asks this one. Kegel exercise is basically need when mother explain the urinary frequency. Okay, urinary frequency or urinary incontinence. In urinary incontinence, mother has difficult to control the sphincter of urinary bladder. But if mother do the Kegel exercise, it can prevent the urinary incontinence. It can prevent the urinary incontinence. If mother has a complaint of urinary incontinence, we tell them to do the Kegel exercise. Kegel exercise like this. So Kegel exercise increase the strength of pelvic floor muscle. Pelvic floor muscle increase the strength, right? So this Kegel exercise prevent the urinary incontinence. At least we know the terminology, the Kegel exercise. When we dealing with the pregnant mother, we have to tell them if any sign like this, mother have to contact with the healthcare provider. Right? First of all, any kind of vaginal bleeding. Vaginal bleeding, most common cause are maybe the placenta, abrupt placenta or placenta previa. This is two most common cause of abnormal bleeding because of during the pregnancy, right? So any kind of abnormal bleeding, they has to inform healthcare provider. Or abdominal pain, right? So sudden abdominal pain or sudden vaginal bleeding, we have to inform. Epigastric pain, although it is the normal, but if the epigastric pain is severe, they have to talk to the healthcare provider. If mother has a visual disturbance, right? If the visual disturbance or severe persistent headache, so we has to, or mother has to inform to healthcare provider. Sometimes the visual disturbance or severe persistent headache, I said, common in case of preeclampsia or eclampsia. Also, maybe it is common. So when mother go for the complaint of this, we have to find out what are the underlying cause. Maybe it is a complication of pregnancy. Also, the change in the fetal movement after quickening. Quickening means the first movement of the baby when mother feel it. So also if the mother, sometime the mother has a pregnancy induced complication or pregnancy induced hypertension. If mother has a pregnancy induced hypertension and if it is not treated, it is lead to the preeclampsia. If preeclampsia is not treated and preeclampsia present with convulsion, this is called eclampsia. So why I'm talking about preeclampsia or eclampsia? Because if mother has a eclampsia or preeclampsia, presentation of them are sometime I said the hypertension or edema or puffiness in the face, right? So painful or urinary or burning sensation of urine, it is indicate also the infection or UTI, or edema on the face, puffiness in the face, food or hand indicate the preeclampsia. Sudden, also a sudden rash, right? Rash of fluid. Elevated temperature indicate the infection, right? Or persistent vomiting after first trimester. So we know that vomiting or morning sickness is common in the first trimester, but if it is continue after the second or third trimester, definitely it is abnormal and mother has to talk to the healthcare provider, right? So persistent vomiting is not good. So here, persistent vomiting and also absence of fetal movement after quickening. So mother feel the movement of the baby first time quickening, but if mother does not feel it for a long time, it indicates the complication arise. So it is the most reportable danger sign of pregnancy, what we should know. I said how we have to monitor the baby will born any kind of genetic defect or not, or if the parents willingly want to know the baby will be healthy or not, how we have to test them. One of the testing we do is called Corionic blood sampling. Another test we do is called amniocentesis. Amniocentesis, right? So here, here the picture showing